Mind Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional in your area.
You can contact us via Twitter at Mind Deconstruct. I'm your host, George. With me is Dr. Kaz. Dr. Kaz Nelson is an American Board of Psychiatry and Neurology certified psychiatrist, licensed to practice medicine in the state of Minnesota, and an assistant professor in the Department of Psychiatry at the University of Minnesota Medical School. On today's episode, Living with Psychosis. What episode is this, Dr. Kaz?
We're on 14 now.
14 episodes of the Mind Deconstructed. Thank you, everyone out there who's supported us up to this point. And for everyone who's finding the podcast, we encourage you to go back and listen to our prior shows. They've been getting better. They've been getting better and better. So take a listen. Please stick with us, and hopefully we'll just keep getting better.
Yeah, we are amateur podcasters. And going back and listening to our earlier episodes, we think, oh, that's a little rough here, a little rough there. And you're right. And so we've been working on editing and working on structuring the show, and hopefully we can be learning and growing in this process.
And our first segment is always Hot Topics in Mental Health, where
Yep.
we try to tie in our topic for today with things that are going on in the world. And today, the Austin City bomber, he was killed, blew himself up actually when the police were closing in on him, but he left some sort of suicide note that mentioned that he thought he might have been a psychopath.
Mm-hmm.
And today's episode is Living with Psychosis. He was, I'm assuming, self-diagnosing himself as potentially a psychopath.
Right. That's where this terminology and definitions become very important, because a lot of the words that we use in psychiatry or mental health have this prefix psycho, like psychology, psychopath, psychosis. All of those things start with the same prefix, but a lot of these words mean very different things. And so that's why we're doing this show today, to talk about what's the difference between psychosis, or this condition of psychopathy, or as the Austin City bomber put it, psychopath. The point of today is to define these things and help you understand the difference so you can navigate this nuance a little better.
So, Dr. Kaz, what is the umbrella term that we are looking for here for these sorts of mental illnesses?
What I mentioned before, the term psycho, P-S-Y-C-H-O, that's simply part of a word meaning that it relates to the mind or psychology. So that's a very general term. So when we drill down into this a little bit more and talk about psychopathy, that's actually something that's a broad term, sort of meaning disturbance of the mind or psychology. And we use that mainly to refer to a subset of people who sort of live without a conscience.
Is that what the Austin City bomber is referring to himself as when he says he believes himself to be a psychopath?
Yes, psychopath or sociopath. These terms are sometimes used interchangeably, but basically that's a type of a condition or a way of being where you can do something that's wrong or do something that hurts another person, maybe kick a puppy or something like that, and feel no remorse about it, have no sense of guilt or shame.
So we're looking at psychopath versus psychosis.
Right. Very different. Psychosis is actually a mental illness symptom. Psychosis is a very general term. It's sort of like saying shortness of breath. Well, you can have shortness of breath because you have a lung disease or a heart disease, or because you haven't worked out in a while and are having shortness of breath after walking up the stairs. So in the same way that lots of different things can ultimately cause shortness of breath, lots of different things can cause psychosis. So when someone has this, we work very hard to try to get to the bottom of what is exactly going on so we can best treat it.
Because psychosis is what again?
That's a symptom where somebody is becoming detached from reality. So you can see how that's very different from somebody who doesn't have a conscience or doesn't feel bad when something happens. Psychosis is a symptom where somebody is detached from reality, and that might mean that they have a hallucination. That's a form of psychosis where you hear things that other people don't hear, or see things or feel things, smell things, taste things that other people don't experience, that's not actually rooted in reality, or have a belief that's not real, like that you're being tracked or chased or pranked or harmed, and it's not actually happening.
So as a psychiatrist, you're dealing more with psychosis than with psychopathy.
Yeah, I would say for me personally, on a day-to-day basis, I'm constantly screening for symptoms of psychosis as part of my daily work. And perhaps a forensic psychiatrist who's working more in the legal system, or people who have been accused of committing crimes or different things, may be screening for conditions like psychopathy.
What is going to cause psychosis in an individual?
There are medical conditions that can cause psychosis. So if you just had a surgery and you're coming out of anesthesia and you start to hallucinate that there's a horse in the hospital room with you, that's a form of psychosis that we can easily see what the cause is, that you had anesthesia and your brain's kind of waking up from anesthesia and you have this hallucination. And so that's one that we can easily say we know what's causing it and treat it and hopefully get the brain functioning back pretty quickly as the anesthesia wears off, for example. But there are other cases where people have symptoms of psychosis or maybe have hallucinations or delusions, and try as we might, we do all sorts of lab testing, brain imaging, all sorts of things, and we can't quite come up with a medical cause for it directly. And then that means that it might be due to a psychiatric condition like schizophrenia, for example.
Okay, so you can have psychosis, can have symptoms. That doesn't necessarily mean that you have schizophrenia, because it could be based on a drug that you had taken or other things like that.
Exactly.
And do you immediately jump to like, oh, this person has schizophrenia or something else? Yeah, it seems like that would be my go-to if someone was saying that they saw a horse in their room.
No, that's actually the last thing we go to. First, we go to, are their lab tests normal? Are their electrolytes healthy? Have they taken a drug in the past few days that might cause this symptom? And so we have to do a little bit of detective work and sometimes even talk to friends or family to get to the bottom of it. But if we rule out any kind of substance or medication or ingestion or medical condition as the cause of it, then we're left with considering conditions like schizophrenia, which is a usually chronic condition that shows up in young adulthood or adulthood, very rarely in children, but it's really a brain disorder that causes these misperceptions.
I actually have a fear that someday I'll develop schizophrenia.
Mm-hmm.
And obviously, or maybe not obviously, I don't know, but I wouldn't realize I have schizophrenia. And I think perhaps that's how it works, where all of a sudden my perception of reality is just different than actual reality, and I'm not privy to that information, and everything just starts getting really weird.
Oh, that's the cruelest aspect of this disorder, is we live our whole life from the second we're born, and all we can do is make sense of our sensory information coming in. And so if there's something wrong with the brain that's impacting that sensory information, it's very common for people to not know that there's a problem and to instead believe their senses. So I sort of compare it to if we were all meeting together as a family with the physician, looking at the person with these symptoms, and we were looking at them and saying, well, you see this table here that you see? There's actually no table here. I know you see and feel a table, but it's not really here. The rest of us don't see and feel this table in this conference room. And to a person who is seeing and feeling the table, they might say, I'm going to believe my senses over the rest of you. And in fact, you all seem to be in some kind of cahoots or conspiracy about this, because there's clearly a table here. And so it's natural for people to believe their senses over the word of someone else.
Is it always like that? Or to someone maybe with drug-induced or other types of psychosis, are they like, I see a horse in the room, I know there's not actually a horse in the room, I think I'm having a psychotic or psychosis type episode?
I've definitely seen that, but I would say that's less common. Sometimes with a lot of conversation, people ultimately develop insight into the fact that their hallucinations or their delusions are not, in fact, true, but it takes a lot of work to get there.
What are the impacts to someone's well-being? I mean, you kind of touched on it, but like in dealing with a reality that's different than everyone else's on a daily basis, that's got to really impact like your well-being.
Yeah, it's stressful. And this is a disorder where, so we're talking about when you have chronic psychosis, the most common cause for something like that is a condition called schizophrenia, which has this sort of old-fashioned name. There's stigma associated with the term, but it's important to know that schizophrenia does refer to this pattern of long-term or chronic psychosis. It doesn't mean somebody changes their mind often, which is how I kind of hear it used popularly in the media. oh, this person was schizophrenic because they thought this on one day and then thought something else the next day. That's sort of a popular use of the term that is not accurate. It is a medical psychiatric condition. It refers to this pattern of brain thinking where the brain misinterprets sensory information coming in and actually processes information differently than perhaps it should. And it does impact life. Imagine walking down the street and you make brief eye contact with somebody. Normally, your brain filters that information out because it's not relevant. But in someone with schizophrenia, their brain puts off a little alarm bell and says, this person is in on it. They're part of the scheme. They're part of the conspiracy.
Does someone with psychosis then need treatment, hospitalization? It would seem to me that they may pose a danger to themselves or others if they're,
misinterpreting.
Yeah, if their reality, potentially is that they need to go out and stab things or, that would be extreme, but it seems plausible.
Most people with psychosis are living in the community, managing their symptoms on a day-to-day basis, working with a physician on the right combination of medications to more effectively manage the symptoms. Very rarely, they maybe require hospitalization if they're having emergency level symptoms or there are issues of safety related to their misinterpretations. So sometimes people will think, oh, my loved one is inhabited by an alien or a demon or some outside force. And very famous case of this was Andrea Yates, the woman who actually drowned some of her children in the bathtub because she felt that that was the only way to save them. And her thinking was clearly influenced by this psychotic process. But that is less common. And more commonly, people are doing their best to function day to day, do their work, be active members of the community.
Can you get someone to come to terms with the fact that there is no chair in the room?
We work on that and develop strategies to try to communicate that clearly and try to help people understand that sometimes your brain, for reasons that we don't understand very well, can play tricks on you in terms of the sensory input and the way you interpret it. But it's not always easy. And it's heartbreaking for families if they have a loved one with this condition. Say it's not at the level of dangerousness where they need to be hospitalized, but it's impacting their well-being, their education, or their professional growth, or their relationships. And if there's low insight about the condition, it's just heartbreaking to see somebody go on and not be in touch with reality and feel like there's nothing you can do.
And we touched on it a little bit, and I guess I mentioned it, but is there a higher risk of violence for someone who's suffering psychosis?
The opposite is true. It's actually higher risk for somebody with a psychotic illness or schizophrenia to be the victim of crime than a perpetrator of crime. So while this does happen time to time for people who have a psychotic illness or are misinterpreting things, it's the wrong conclusion to assume that somebody who commits violence is doing so because they have a mental illness.
And I assume that they're at a higher risk of crime just because of the high level of vulnerability that they're facing.
Yeah, they may misinterpret something or not be caring for themselves or put themselves in a risky or vulnerable situation due to judgment or choices that are influenced by their psychotic illness.
Well, we do have a listener question. A listener asked Dr. Kaz, I know schizophrenia is often confused with multiple personality disorder. Could you further explain the difference?
Yes, absolutely. So this is very common that when we talk about schizophrenia, people say, wait a minute, I don't have multiple personality disorders, or kind of like I mentioned before, there's this popular understanding that the term schizophrenia means that you sort of change your mind or your way of being about things and the way you approach the world. And that's not true. There is a condition called dissociative identity disorder, DID for short.
Which is the new name for multiple personality disorder.
Yep, that's kind of a updated term. And this is a real condition. And there are some people, particularly people who have endured extreme trauma, who have this condition. It's not necessarily a condition that has psychosis as part of it, but it sometimes does. So there can be some overlap between dissociative identity disorder and schizophrenia, but they're completely different conditions. And as I mentioned before, schizophrenia is primarily a psychotic disorder, whereas DID is something more related to survival skills that the brain needed to adopt to endure extreme circumstances.
you mentioned it, but most people with schizophrenia aren't locked away somewhere.
No, absolutely not. They're living in the community and functioning the best they can. Some have periods of wellness between episodes of psychosis, and some have psychotic symptoms all the time that influence them day to day. And this can take the form of hallucinations. They may be just at the grocery store and there's a voice in their head saying, buy that, don't buy that, you're worthless, that was stupid. And sometimes it's easy to think, well, can't you just ignore those voices? Or if you know that they're not real, just live your life without them. But I bet if I followed you around and was kind of talking in your ear this way and making stream of consciousness remarks about the things you were doing and the choices you were making, you would find that very hard to ignore and suppress that.
Yeah.
And medications sometimes move those voices to the background of one's mind. And even that's a step forward. But these are strong medications that we use in psychosis, and they help to varying degrees. And oftentimes it takes trials of different medications to see which medication is going to be the right one for you, and managing some of the strong side effects that can come along with antipsychotics. It's sometimes a very tough conversation, particularly for people who are struggling with insight about the illness, to say, here, take this very strong medication with side effects every day. And so we're trained in psychiatry to have those heart-to-heart conversations and try to meet in the middle somewhere.
Sounds good. Dr. Kaz, going back to the Austin city bomber, him saying he's a psychopath, that really then has nothing to do with psychosis.
Right. I think that's important for us to clear up, and one of the reasons why we're talking about this today, that just because he used this terminology and made kind of this self-diagnosis of being a psychopath, that doesn't necessarily mean that he had a type of mental illness that has the symptom of psychosis or something like schizophrenia. We just cannot conflate these things. In that note, he did use that term, and I want to clear up what was meant by that so that we're not jumping to the conclusion that perhaps he had some kind of mental illness.
Thanks, Dr. Kaz. I know a lot more about psychosis now. Anyone out there with any other topics that you want to hear us discuss, or any other questions or even concerns, feel free to check out our website, theminddeconstructed.org. Send us an email, tweet at us, whatever it takes. We're here listening.
Yeah, thank you very much.
Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter at Mind Deconstruct.